Good morning. It's time now for another edition of Our Town here on 94.9 and 99.1 The River. My name is Darren Swenson. Our Town, as always, brought to you by our good friends at Decorah Bank and Trust. Our guest on the program this morning, it's National Hospital Week, so we're going to talk to representatives from WinnMed and Decorah and Veterans Memorial Hospital walk-on. Veterans Memorial Hospital CEO Michael Coyle will join us on the program. And Dr.Tom Marquardt, the Chief Medical Officer at WinnMed in Decorah, will tell us about everything going on with those two organizations. But our first guest this morning, it's sytennde weekend in Spring Grove, and a lot of things going on both Friday, Saturday, and Sunday. I don't know if that's both when I mentioned three things, but you get the picture. Sytennde weekend this weekend in Spring Grove. Rachel Collins is going to be our first guest. She will start things off here on Our Town. It's brought to you by Decorah Bank and Trust, and you're listening to it on 94.9 and 99.1 The River. This weekend, it's the Sytennde Festival up in Spring Grove. Rennae Collins joins us to talk about Sytennde, and Rennae, a full weekend of activities. Just a fun small town celebration, celebrating the Norwegian heritage of Spring Grove, and quite a few things that are going on this weekend. It started last night with the Queen coronation and music in the market, and all sorts of things going on over the next few days. Let's just run down the Friday schedule of Sytennde events.
Sure. We got lots of stuff going on Friday. The Children Parade is at 1, and Merchants Bank is having a community appreciation lunch that's open to the public. Giants has their Olaf Chomi exhibit that starts at 10. The brat stand opens up, so a lot of stuff going on.
And a quilt guild show that day by Peacemakers as well. And nice thing about a lot of the events this weekend, they're free of charge, so you can entertain yourself and see a lot of things going on this weekend. As we continue on and look at the events coming up on Saturday, tell us about some of the events going on there.
Sure. The quilt show, like you said, that carries on over into Saturday and to Sunday, and we have lots of stuff going on at the Giants. They have I think what they call a Taste of Norway dinner. There's 3 different times for that, and the bake sale is at the Giants at the Heritage Center. We have lots of stuff in the park for the kids. We have inflatables, a petting zoo, face painting, balloon animals. We have laser tag, that's new this year. We have caricature artists coming in. Cornhole or bags, that's at 1, and that's in front of the Legion this year. Soapbox, Kirby train, you name it, it's happening. We have food trucks, all the things.
And of course, any event isn't fully complete without the Grand Parade coming up on Saturday.
Of course, everybody loves the parade at noon, starting off.
And can people still put entries in the parade if they're interested? How do they do so?
Absolutely. They can reach out to us through the website, and we can get their parade entry that way.
And you mentioned the website, all sorts of great information that people can read about the events coming up this weekend. What is that website?
That's sgsytennde.com.
And you got the schedules, you got the highlights, you got the food vendors and everything like that. And any good small town festival isn't completely full without the food vendors, without the restaurants, without something to eat. I'd imagine it's one of those situations, if you go away hungry from Spring Grove this weekend, it's your own fault, right?
Right. It'd be awfully sad for you. Yes. Lots of opportunities.
And how many people does it take to organize this event? How many folks kind of get together and make everything happen?
Yeah, we have a small but mighty group, about 5 to 6. So making it work. Yeah.
And how
always taking new members. Always taking new members.
How much time do you put in? When did the planning for this weekend's events really start?
Oh, it starts at the beginning of the year. We start between December and January, getting everything rolling, booking everything. Yeah, absolutely.
And if people are interested in being a part of this in years to come, how do they do so?
Oh, they can reach out to any of the committee members that are ongoing right now. They can reach to us through Facebook, email, website. We're easy to get a hold of.
All right, Rennae, tell us the final who, what, where, when, and why, and give folks an invitation to come to Spring Grove this weekend.
Yes, everybody come join us Wednesday through Saturday or Wednesday through Sunday this week. Spring Grove, Minnesota. Lots of things to do. We'll keep you busy.
All right, Rennae, we appreciate you taking some time
Oh,
to tell
thanks
us
for having
about
me.
sytennde this weekend. Best of luck with everything going on. And again, thanks for the time.
Yeah, thank you. You have a great one.
Rennae Collins joining us, sytennde taking place this weekend in Spring Grove. National Hospital Week, and we check in with WinnMed and Dr. Tom Marquardt. He's Chief Medical Officer at WinnMed. I got to get used to the new name. I know it's something that's changed as of recently, and there's a lot of things going on at WinnMed, and most recently is the addition of a pharmacy on campus. How has that been going in its early stages?
It's been really great, Darren. Thank you for the question, and thanks for having us as part of this opportunity to share with you and the community as we celebrate National Hospital Week. There's a lot of things going on here this week in particular as it relates to National Hospital Week, but more specifically, as you talk about the pharmacy, we're really glad to have that pharmacy here on campus and kind of bring that pharmacy opportunity here to the local community through the partnership here with WinnMed, the county-owned hospital that now has a pharmacy on campus.
And when you look at a pharmacy being on campus, is this something that more medical facilities are doing across the nation, maybe even in our region?
Yeah, we're probably a little bit behind the time there in that regard. I don't know that it's anything new, but it's probably something that has always been on our radar. We've tried to be sensitive about, over stuffing the market, I guess, from a pharmacy standpoint. But it was clearly time for us to have that consideration. There are different programs that reimburse differently, and having that pharmacy as part of our overall kind of business plan, I think has always been there, but it's been super exciting for us to really add that to our complement of services here. Of course, there's lots of advantages from a convenience standpoint. One of the big things that we really enjoy, and we're hearing a lot of positive feedback on, is with regards to the drive up. So, being able to pick up your prescription without having to get out of your car, having that drive up window capability has been one of the positives that we've obtained, and we've heard from patients how much that is appreciated.
And of course, the facility will be seeing some changes and already has seen some changes, and we'll be seeing some more changes as time goes by with the facility plan that was passed recently. Where is the progress on that coming, and what will folks notice next, I guess?
Yeah, so when we spoke, it was maybe a year ago at Hospital Week, I believe we were talking about this project. We referred to it as Transforming Tomorrow. That was approved by the board late summer, early fall, and with the timing of the approval and the weather, we postponed putting shovels in the ground, so to speak, until the spring of the year. Most may remember we had a pretty mild winter, and so spring came early, and we were able to start early. But the project really consists of three larger changes. The first of those changes is renovating our OB department, something that's been long overdue. And that was the first thing that started. So internally, there was a lot of tear down and destruction of the current OB department. that whole project timeframe for renovating the OB is about 9 months. And so that started early. And now if you drive onto our campus, you'll see backhoes and bulldozers and things moving earth. And that really is part 2 and part 3 of the project. And that is adding additional operative space. So we're adding 2 OR rooms. And then our central processing or sterile facility where we clean our instrumentations as part of that surgical renovation. And then the third part is really doubling our clinic size. We are really completely out of clinical space. We continue to recruit new physicians to the community. And we're really struggling just having places to put those new physicians. And so the need for increased clinical space has long been there. We've modified our clinical space numerous times to accommodate, but it's certainly time to have more space. And we're doubling our clinical space, and that part of the project is taking place as well.
And the more and more services that you can provide in Decorah, and people don't have to go an hour and a half, hour, 2 hours away, that's better for everybody involved, correct?
Absolutely. You hit it right on the head there. Really, that the more service we can provide locally, the bigger the win for our community and for our patients. Being able to get that care locally has been a long desire of ours, and we continue to advocate for that. We've added specialties like allergy. We've added specialties like OBGYN. We have a dermatologist that will be joining our group next summer. And so all of that, is again a service line expansion, but there's just no way we could do it if we didn't have our primary care base of care. And so our family medicine practice, which is really the roots of our practice, continues to grow, and we continue to recruit for our primary care practice as well.
And from a management and a balancing everything perspective right now, how do you keep doing what you're doing very well, but at the same time looking towards the future and trying to determine that, hey, this is a good fit for WinnMed in the future? Where's that fine line?
Yeah, I mean that's great. It's a great question. It's trying to be cognizant of the demands and the needs of what would be considered rural medicine. Are we considered to be a rural location? Are we considered to be a medical desert of sorts? And I think that answer varies depending on what specialty you talk about. But we can clearly see from information and from data, what our patient draw is, and we want to draw from the region. We can also see what our patient demand is from a service line situation. There's a high need for cardiology. There's a high need for oncology. And we look to consider recruiting efforts for those service lines as well. And that's really data driven. We have that information that says, this is the kind of stuff that we need here. And so we look to that information and that data to help kind of guide those decisions.
And what's kind of next on the agenda as you look towards the future?
Yeah, well, I guess I kind of alluded to some of those things. Our big project really is the Transforming Tomorrow. We're looking at 24 to 36 months of work here. There's a lot that will go into that. There's a lot of logistics as to who moves where and when we move and how we do those things. So that is absolutely on our radar. And again, I think planning for the future, making sure that we have the capital investments that are necessary to support the physicians that are coming out of training. Clearly, we see that is different, and that's what we want to see. We want to see those new, younger physicians coming out with different skill sets and their requirements for the quote unquote tools that they need change as well. And so that usually is equipment and capital investment in those things. And so we're keeping an eye on that as well as we continue to move forward.
And how important is it to have stable healthcare just as an economic development tool for the region?
Yeah, I mean, absolutely. It's one of the key factors, right? You know, local banking and local healthcare and the housing market, all of those things really are important for a local economy to continue to thrive and survive. You know, I don't think we're alone here when we talk about some of the challenges that we have as an organization, and that is really the housing market. I don't think that's new. We hear that from other sectors of our economic impact and economic development, and that is the need for housing. And so all of these things kind of work hand in hand, there's no doubt, but those present some of the challenges that we face as well.
Anything we're missing? Anything else you want to sell about yourselves as long as you got the forum this morning?
Yeah, no, I appreciate that. Again, I think what brings us together really is the fact that we're celebrating Hospital Week this week. And so we want to make sure that we're recognizing all of those employees and staff that help our organization open the doors every day. We're a pretty large employer now. I think we're up north of 600 maybe as far as our employees here locally at the hospital. And we want to thank them and recognize them for the hard work that they do. We have lots of things that we're doing this week to recognize that. We have a cookout today for our employees. We have a pizza day on Friday. We had popcorn and ice cream on Mondays and Tuesdays. Again, just taking little things and little moments to really thank the WinnMed staff for everything that they're doing to help us keep moving forward.
All right, Doc, appreciate you taking the time to tell us everything going on at WinnMed. And we thank you and everybody at WinnMed for what they do for our community.
Thank you, Darren. Appreciate your time.
Dr. Tom Marquardt, Chief Medical Officer at WinnMed in Decorah. Well, it's National Hospital Week, and we check in with the folks at Veterans Memorial Hospital in Waukon. Micheal Coyle is the CEO of Veterans Memorial Hospital. And Micheal, I know Veterans Memorial Hospital did a lot of things last week, and last Friday night, the community came out, had a lot of fun, and raised a lot of money for a good cause. How does it feel as a representative of Veterans Memorial Hospital to get that community support that you saw last Friday?
It was a great week here at Veterans Memorial Hospital. It actually started on Wednesday with our health fair. We had well over 300 people attend our health fair here. Our partners at Gunderson, we had over 40 booths, and people came and toured the helicopter, toured clinics, toured the hospital. So that was a great kickoff to Hospital Week. But even better was that concert on Friday. The toe tapper started out at 6 o'clock, and the joint was packed by 5:15. You know, I've been in Waukon for 4 years now. I have not seen the pavilion that full ever. And I don't even know if we could have fit 5 more people in that place Friday night. It was full. And so just a big shout out to the bands that came out, and most importantly, the people that supported us. I know that the pavilion made some money on their sales, and we did pretty well to raise money for our new Pyxis for the emergency room.
And tell us about the fundraising efforts and where that was being put towards. Really a unique and new thing in modern medicine, but it's a great idea on the surface. Tell us about that again.
Yeah, this is our second Pyxis machine. We got one a couple years ago through a grant. Now, this Pyxis machine will go into our emergency room. And really what it does is it's all about patient safety. And so in the emergency room, when we put medications into the machine, it's basically an automated medication dispensary machine where the physician will put in the order for the med. The nurse will go to the computer, look at the medication, verify the medication. When she or he goes to dispense the med, and whatever med that is, the drawer will actually pop open and a cubby will open up, and that's the only drug that nurse can use for the patient. So we ensure that it's the right drug at the right time for that one only patient. That reduces any chance of giving the wrong med to the wrong patient. So it's all about patient safety. So we're excited that the foundation has decided that that is a huge need and has been willing to help us raise money for that machine.
And I'll ask you the open-ended question, this being National Hospital Week. How important are rural hospitals to the overall health and economic viability of rural Iowa?
Well, it's extremely important. You know, VMH is one of the largest employers in Almaty County. We have a $16.5 million payroll, and the economic impact of that is well over $50 million in the region. So we employ, you know, roughly 250 to 300 people that spend their money, make their money here in Northeast Iowa. And we bring, you know, we employ everybody from housekeepers to physicians to administrators to nurses to just about any other work group. And again, being one of the largest employers, it's really important that we get back to Northeast Iowa. And what we're finding over the last few years, especially since we opened both of our clinics, we're starting to draw folks from outside of Northeast Iowa, outside of the state, and folks come into our medical clinic. Our primary area has grown about 25 miles over the last couple years. So that's impressive. That's putting money back into our communities.
And I imagine whenever you can offer services in walk-on or your clinic in Postville that people don't have to travel an hour and a half, 2 hours to, that's just a win-win situation for all involved, correct?
Oh, it is. You know, just think about this. For a lot of people that work in Northeast Iowa, a lot of those jobs don't have benefits. And so if you take a day off, it's usually a day off without pay. And then if you're working in a small business, that business owner has to find somebody to fill in for you. Many times you're going to, you know, a larger tertiary center like Gunderson or Mayo, and you're there for 15, 20-minute appointment, but you're out of town for a half a day. You're spending money on meals and food, and you're spending money in a different healthcare system. And those are dollars leaving our communities, dollars that we use to support small businesses in Northeast Iowa.
As for the transition from a city-owned facility to a county-owned facility, is all that from a logistical standpoint pretty much done now?
Yeah, the only thing we have left to do is we're completing the lease agreement with the medical office building in Gunderson. That is the last little thing that we have to do. It's not a little thing, it's kind of a big thing, but we're just putting the final touches in that. We should have that done here in the next 30, 35, 40 days, right in there. We're waiting on, you know, the bigger system in Gunderson to get through, you know, their legal department. But otherwise, we have the rest of the paperwork ready to go on our side. The deeds have all been completed, and the paperwork on our end has been completed. Otherwise, yes, everything else is going to be done. We are going to have some openings on the board. We're going to have 3 openings on our board of trustees. And so if we got listeners out there that are interested in running for the board of trustees, please reach out to us and we can give you an idea of what that work is going to be like and what some of the deadlines are to run on for the board.
And that would be for this November's election, correct?
That is correct. Yep. So it's an open election for all the seats, but I know that there's a few of the current board that will be rerunning, but there are a few that won't be. So there definitely going to be some opportunities for those that want to serve.
As for the plans as you look into the future, both short-term and long-term, what are the top items on the agenda when you're looking at both those matters moving forward as an organization?
Well, for one, we're switching our electronic health record to Epic. We're going to partner with the University of Iowa, and we'll be switching our current electronic health record from a company called CPSI to a company called Epic, based out of Verona, Wisconsin. And that's the software that most organizations now use. By 2026, about 70 to 75% of all covered lives will have an Epic as their electronic health record. So that's one big deal. The other big deal is physician recruitment. We are working extremely hard to bring more physicians to our community. And I know Gunderson's clinic is working very hard to do that as well. You know, we have some great associate staff, nurse practitioners, and PAs, but we can't run a hospital without physicians. And so we have several physicians coming over the next few months for site visits and working very diligently to get them to sign a contract and call this their next home.
And I know Gunderson and Veterans Memorial Hospital are technically separate entities, but in what ways do you work together for the benefit of the community and the patients that you serve?
Well, we are very good strategic partners. So, for example, we share some specialties. So, our general surgery coverage comes from Gunderson, Dr. Yee and his team. They cover our OB, C-sections, and our general surgery. Dr. Valkowski, the podiatry, works with our Dr. Thompson, our podiatrist, to cover that. We utilize Raquel Ristow in our hospitalist program that we started here in April. And then, of course, we use Gunderson for our reference lab to do some radiology reads. And we send a lot of patients to Gunderson for care that we just don't have the ability to offer here. So great partnership, and we look forward to keeping that partnership in the long term.
As it's National Hospital Week, I'll give you an opportunity to tell us whatever else that's on your mind, an opportunity to sell yourselves at Veterans Memorial Hospital.
Well, this last year and a half, we've been pretty proud of the care that we've been given. Our hospital has won some pretty distinguished awards. We are recognized as the cleanest facility in the country by Medicare. We've also been recognized as a top 1%er in patient outcomes and patient satisfaction, ranked in the 1% of all hospitals in the country. And that's just an accomplishment that doesn't really happen in rural hospitals. But our staff is just, you can't find a better staff. And it really, all those outcomes are all about what we do here at VMH. And that's putting the patient at the center of everything we do. Every decision that we do, every time that we buy a piece of equipment, every time that we start a new service line, it's all about ensuring that the patient has the best overall experience and the best overall outcome. And we'll continue to do that. The other thing that we'll continue to do here is you said this before, trying to find ways to keep our patients close to home. We don't want you to have to go an hour and a half to do something. We want those services here. So we'll continue to partner with Gunderson, but we'll continue to find other partners to find specialties that will help treat patients locally and keep you here. So that's our commitment to patient quality and patient outcomes. So and we're always looking for staff. So we have some openings for RNs, and we have some other specialty openings in lab and X-ray. What a great place to work. You'll never find a better place. Really, our kind of our mantra here is family taking care of family. And that's really what we do. And we're pretty proud of that.
All right, Michael, we appreciate you taking some time to tell us everything that's going on at Veterans Memorial Hospital. Happy National Hospital Week, and we thank you and everyone of the staff and everyone involved at Veterans Memorial Hospital for what they do for our community.
Thank you. Appreciate it.
Michael Coyle from Veterans Memorial Hospital in Waukon. Our thanks to our guest on the program this morning, Rachel Collins from Spring Grove. Sytennde coming up this weekend, Friday, Saturday, and Sunday. A complete list of events. sgsytennde.com, the place to go for all of your information on that end of things. Dr. Tom Marquardt with WinnMed in Decorah, and Michael Coyle with Veterans Memorial Hospital in Waukon. We have them on each and every year for National Hospital Week, and we thank them for taking the time to join us today. Don't forget, we put these shows on YouTube. We realize you're a busy person. A lot of things going on, a lot of things in the hopper. Can't always have time to be near a smart speaker or a radio at 9 a.m. on a Thursday morning, but we talk to interesting people, and we think we talk about interesting things, and we want to give you the opportunity to listen and watch these interviews at your discretion. 5-16 Our Town program is the best way to look it up if you're out on YouTube, and we also put the links up on all of our LA Communications Facebook pages. Thanks to our guest on the program. Thanks to our sponsor, Decorah Bank and Trust. And most importantly, we thank you. That's right, you, for tuning in, for logging on, or for watching Our Town on 94.9 and 99.1 The River.